About 4 years ago, the hospital noticed that there was a high incidence of pneumonia in post-operative patients, and we decided to tackle all post-op patients, but most importantly to tackle the ICU patients who are on a ventilator and are at risk of developing a pneumonia.
And when we learned about the Safer Healthcare Now initiative, we really linked up this team with Safer Healthcare Now, and the results have been fabulous.
So our first initiative was really to maintain the head of the bed of patients elevated at an angle greater than 30 degrees. The second strategy that we used was the implementation of the subglottic drainage, or the EVAC tube.
The EVAC tube has been implemented almost for a year now, and it's been very successful, I find, because the incidence of pneumonia had decreased since we started using the EVAC, and it shows that there is an improvement in the incidence of pneumonia in the unit by 50%.
That's because we rolled out our interventions in a very deliberate way. And we have not fallen back. So we've been able to sustain it and in fact even spread it into the other units who contribute ventilated patients to us.
And now we see more and more of EVAC tube implemented almost in every crash cart in the hospital.
It grew very slowly in the sense that we've decided to run PDSA cycle on one element of the bundle initially until the team was familiar with the actual process of the improvement methodology. And once we mastered that, we went into the other elements of the bundle. The idea was to develop behavior change and change in the culture of the unit rather than saying that we're going on a campaign and it's going to last for a finite time and then nobody will be taking care of it.
The Safer Healthcare Now campaign has helped us in providing us with some written material that is very well detailed about how to reach out our objectives.
Through the feedback from the reports that we have to hand in every month, they comment on our work, on our results. There is a listserv within which we can interact and ask questions regarding our specific interventions or others. So it creates a community of interested people who end up being experts.
To be participating in a cross-Canada initiative is very, very exciting for patients because it means that interventions that are working in one place can travel more quickly across the country so that patients can feel the effects sooner and we can make our healthcare system safer.